Welcome! Thank you for joining us for the third and final webinar in the Pilot Grants series this year for the Collaborative Research Center for American Indian Health, also known as CRCAIH. My name is Danielle Kenyon, and I am the Program Director for CRCAIH. I help the Principal Investigator, Dr. Amy Elliott, with administration of the grant activities and also head up the Pilot Grants Program Subcommittee. I also want to let you know that this webinar will be recorded for future use. These slides will be available on our website, CRCAIH.org, for future reference. The past two webinars are also housed there and would be great to reference as you're preparing your application. Also, currently we have everyone on mute, and then for the question and answer portion at the end, we will unmute your lines for questions. We will hold questions until the end, but please feel free to type in your questions in the box at any time. With the question and answer period, feel free to ask any questions on preparing your grant. This is the time to get all of those questions out. No question will be too technical, and I'm sure there's lots of people out there with similar questions. So this webinar today is especially great in our series because it goes into the specific details of the CRCAIH Pilot Grant RFA and application. I'm honored to introduce our fabulous grant team here at Sanford. We have Rhonda, Tabitha, and Molly, who are here to share their expertise with you. I can't stress enough how helpful they will be in putting together your grant application. Rhonda will be your main contact throughout this process and will be presenting on today. So to briefly overview the purpose of the Pilot Grants program, the first point that we're really stressing with the CRCAIH Pilot Grants is the importance of building that transdisciplinary team. So what you want to do with your application is to demonstrate to the reviewers that you have really good and strong collaborations already in place, with each of the partners addressing the research question from different perspectives. So everyone, stressing in your application that everyone on your team is bringing their different strengths to create this transdisciplinary approach. So the second thing that you'll want to do with your application and all of the research questions and projects, that they should embrace the social determinants of health theme, leading to the improvement of American Indian health. So with this being very clear in your proposal on the importance of your health outcome or topic that you're interested in, how this relates to and why it's important to American Indian health populations in North Dakota, South Dakota, or Minnesota. So in your proposal, you want to use previous literature to show how your health outcome of interest is influenced by the social determinants of health. So social determinants of health are those environmental factors such as individual and community behaviors, as well as social conditions, including socioeconomic, social, political conditions, and cultural factors that may influence your health outcome. So we really also see this, the purpose of the Pilot Grants program is the opportunity for organizations and investigators to get data for research questions they have and utilize that pilot data to apply for future funding mechanisms. So we see this as an investment in young investigators, and we'd really like to see how the research knowledge gained in these pilot grants, and so that you have the data to help drive what we know about American Indian health forward in the research literature and how that can move on to fund projects in the future. So just a reminder, I'm sure you've all have accessed the RFA and application. They are housed online at CRCAIH.org/pilot-grants. And I'm sure, hopefully, by now you've read and reread the RFA over and over again, marking it up with your ideas for your project. And please highlight where you may have questions or concerns. So for eligibility, there's a couple of levels of eligibility that we look at for the Pilot Grants program application. So those are different levels of whether the organization is eligible and the applicants or the investigators. So for the organizations to be eligible, we look at any organization like community, tribal organization, businesses, local government entities, schools, higher education organizations, advocacy, state, regional organizations, Any type of organization, as long as you're eligible to receive federal funding, are eligible to apply. So this eligibility is shown through the information on the first couple of pages in the application with the DUNS and employer identification number. So if you have any questions about your institution's eligibility, please contact your fiscal office. And if you have questions about who to contact in that office, please feel free to ask Rhonda or reach out to our grants office for more information and ideas on how to do that. So for eligibility of applicants, this is any individual with skills, knowledge, and resources necessary to carry out the proposed research project. So with our pilot grant applications, we don't have any limitation on the type of degree that the principal investigator holds or any requirement there. So what we do have limitations on, since this is the second pilot grants program, we do have rules about repeat applicants. So no currently funded investigators on our research projects are applicable. They're not able to apply. So this precludes any first-year pilot grant awardees, but if you have been involved in an active award, you can be involved in new applications, but in a non-principal investigator capacity. And of course, the project timeline. So just a reminder of our timeline. Next Monday is the deadline for the letters of intent. And those are not required, but highly encouraged. So we would really love to see and have everybody submit a letter of intent. The application deadline, which is coming up, is February 24th. So a little over a month left to go until those applications are due, and those are due at 5 o'clock Central Time. The notification of awards after our external review, we plan to do those notification of those chosen awardees about mid-April, then requiring a little more information and just-in-time information that we send out for NIH for review. And then the funding period that we're looking at is August 1st of this year through the end of July of next year. So the pilot grants being a one-year project. This is stated in the RFA, but always good to mention what the budget is. So our CRCAIH Pilot Grants program will invest approximately $240,000 this cycle of direct costs. So for each project, what we'd like to see in the applications, the projects that range from, with direct costs from $25,000 to $80,000 for the year period. And the indirect costs are also allowed on top of your direct costs at your institution's approved negotiated rate. So we anticipate about 3 to 5 pilot grants awarded this year, and that will just depend on what level of funding the projects come in at. And again, as you prepare your application, just to do a reminder about CRCAIH's Division and Core Resources. I'm sure a lot of you were able to join us for our first webinar in December, which focused on the CRCAIH resources from the cores and divisions. And for greater detail, please see the website for that whole presentation. But some of the divisions and cores that are available as you prepare your application, just to quickly outline what they can all do for you. The administrative division, which is where I'm housed, and we love to talk to you about your project. And a lot of what we do is discussion with applicants about your eligibility, the fit of your proposal idea, the general design of your study, how to get that to fit within a scale of 1 year. We can also assist with evaluation and measurement ideas. So a lot of times I would be one of your first contacts, happy to run the idea past myself and bounce back any ideas. The Community Engagement and Innovation Division, some of you may have experience with research, but less so working with American Indian communities. So the Community Engagement and Innovation Division is happy to assist with general information and knowledge about potential tribal partners and organizations and how to best engage different communities in research. the regulatory knowledge core is applicable to basically everyone. So even those of you with lots of previous institutional review board experience may want to consult with the regulatory knowledge core because every project is different. Much of the consultation with regulatory may happen after the award, but specifically for the proposal, there's a section where you may detail how you protect your human subjects and how you fill out that planned enrollment table. A lot of times people have questions on that, so they're very happy to talk with you about how to best do that. They're also happy to review ideas for which IRBs you would need to review your protocols. The methodology core is sometimes helpful when investigators don't have an in-house statistician. So they're very happy to consult with you on their design, power analysis, measurement, types of analysis, options for data storage, basically any research design or methodology question you would have. And then finally, the culture science and bioethics core serves because they have expertise on American Indian cultural perspectives on research and how to best observe those cultural protocols. They can help give advice on feasibility of working with American Indian communities and how to approach different communities to do research. So we look forward, on behalf of all of our CRCA cores and divisions, we really look forward to working with each and every one of you, closely assisting with you on preparation of the grant and also afterwards as you conduct your grant. So please contact the cores and division resources early. And with last year, we expect things to get hectic towards the deadline. So I expect this next month will be really fun with working with all of you. So feel free to use this general email and number to connect with the right people. And then finally, the first deadline that's coming up is that letter of intent. Again, we are highly encouraging all of you to submit a letter of intent. And if you're here on this webinar, we're guessing that you're very interested in our pilot grants. And if you have a good idea and are pretty sure you're going to apply, please go ahead and submit the letter. It's non-binding, so it doesn't mean that you have to apply for the grant. But it helps give us an idea of how many applications we're going to get, the different topics that we will be receiving so that we can best prepare our external review team. So all of the information on the letter of intent is very simple. It's a descriptive title of your proposed research, and that doesn't mean that can't change. Just a brief paragraph outlining the purpose of the project, your name, address, and number of the principal investigators or other key personnel, and then those participating institutions. So again, please send that care of Dr. Amy Elliott by January 27th.
Hello everyone, this is Rhonda Hinch. I'm at the Sanford Grants office, and I'm going to take you through the application and what is the requirements are for the application package. We'll start on the cover sheet, and the first thing we have to look at is we are following the PHS 398 guidelines on the application, and titles may only be 81 characters. Any characters more than that, they will not be accepted by NIH. So please follow that. Also, the type of application, there are new and revised. Anyone submitting from last year will check the revise button and put in the date that they submitted their application. Funds requested, the total amount requested is from total direct is from $25,000 to $80,000, and the indirect amount is on top of that. So I think that's pretty self-explanatory on how to complete that section. And we also asked the question on whether there is prior funding or requested funding for this proposal, so please answer that question. And then we get to the applicant organization. We do need to have the applicant organization complete the DUNS and EIN information in the proposal. It's required by NIH. It will be a triage section for when the grants come in. If this section is not completed, we could possibly triage the project because of that. If you do not know your institution's DUNS number or EIN number, please contact someone in the finance department for your institution. For the DUNS number, EIN, it should be hand in hand. They will have both of those. We also need to put the zip code +4. So if you know your zip code +4 for your entity, it would be very helpful if you would complete that section also. Type of organization is quite common. Just check the box on what kind of organization you are in. And authorized organizational representative or signing official, that is who signs off, who is the SO for your institution. That person's name and address will be included on there, and they will also we will require their signature. Same as principal investigator. This application, you can have a multiple PI. There will be a primary PI for the institution, so please put that on the cover sheet, and then the co-PI would be on the next section. Site locations, we want required, you need to put the DUNS number for each of the locations you're going to possibly be completing your project, and the zip +4. Each of these are, if you need to add locations on, the Word document that's provided in the application will let you just cut and paste additional sites on there. And again, at the end of the cover page, the signatures are required for the principal investigator and the signing official. And these are mandatory in the application. The next section is for project descriptions. We are requesting a project abstract, which will include your aims, objectives, research design and methods, and it's not to exceed more than 500 words. Also, we are requesting a project narrative, which is a brief overview of the project and describe the relevance, and this information will be for public access, and we wish this information to be between 3 and 5 sentences. Biographical sketches. It is required that all biographical sketches be in the current NIH format, and this is required for the PI and all key personnel. You can include bio sketches for significant contributors if you so choose to. Biographical sketches will also be included in the Appendix A section of the application, and each of the bio sketches cannot exceed more than 4 pages per person. Facilities, equipment, and resources. Each of your resources or facilities that you're going to be working with, you want to identify the facilities and equipment that is available for this project, and you want to identify if you're using multiple location sites. We are requesting you describe the resources at each of those sites, and please discuss ways in which the proposed studies are transdisciplinary and will benefit the unique features of the environment or the subject population, or will employ useful collaboration arrangements in those sections. The research strategy. Each of the sections will need to include the appropriate headings, specific aims, significance, innovation, and approach. The specific aims page is limited to 1 page, and for a total of 6 pages. Cited relevant publications are to be cited in the research strategy, but will You will provide a full reference in the reference and cited section of the application. Sorry. Research strategy. If you need tips on how to write a proposal, please go to the CRCA website and you can review the webinar that was given previously. References cited. There's no page limit for the references cited, and it comes after the research strategy. Each of the references must include the name of the authors, the article title, journal or book title, volume number, page number, and year of publication. And again, the references are not included in the 6-page research plan limit. Human subjects. Anyone that is using human subjects in their proposal must complete this section. They must address the adequacy of protection for the research participants, the risks, and the inclusion of women, minorities, and children based on the information of the proposal. Anyone using human subjects must complete the planned enrollment form that's in the application, and you have to fill it out in its entirety. It's a requirement by NIH. You also need to include a section on inclusion of children. If you're using children in your application, you must tell us what you're going to be doing, what age group you're going to be doing, those types of things, and how the IRB process is working with how you're consenting those children. There's also a section on institutional review approval, and that section will also need to be completed. And please, appropriate IRB approvals is required to the start of the project. It's not required when you submit your application. Any approvals that you have already obtained must please include in the attachment in Appendix C. And again, if you have approvals from other IRBs that have been obtained, they go in section Appendix C also. And you need to also include, copy and paste the questions from section C and complete it for each of the individual IRBs that you will need to be using. Multiple leadership plan. I thought it's the multiple principal investigator leadership plan. You need to provide a rationale why you're choosing to do a multiple PI approach. Not everyone will be doing that, but if you are, you need to explain that. You also need to describe and governance and organization structure of the leadership team. You need to explain how you're going to communicate, how you're going to work together, who's in charge of what roles and administrative and technical and scientific responsibilities within the project. And a brief description on what the difference is between a principal investigator, co-PI, and co-investigator. A principal investigator is a project leader with scientific, fiscal, and administrative responsibilities. Co-principal investigators, in some cases, particularly with multiple site projects, more than one individual is considered as responsible for administrative, fiscal, and scientific conduct of the project. Each person can be named in the proposal and on project documentation as a co-PI. Co-investigators in most cases are several individuals that conduct the scientific portion of a project. One of these investigators is named the PI, while the other investigators will be considered co-investigators and assist the PI in the project. Consortium arrangements. You must explain the programmatic, fiscal, and administrative arrangements to be made between the applicant organization and the consortium arrangement. If available, and have a copy of a consortium or contractual agreement. This must be included in Appendix B. Letters of support. Letters from collaborating organizations are mandatory, and especially tribal partners are mandatory. There is not a page limit for tribal letters of support, and these must be included in section Appendix B. Resource sharing plan and data management plan. Provide a detailed explanation of how the data will be collected, analyzed, and interpreted. Also provide a brief one-paragraph description of how the final data will be shared, or explain why data sharing is not possible. Budget and budget justification. The Grants Office would like to highly recommend that you would work with the Sanford office to complete your budget, just to make sure that it's in the right format, and all the expenses and costs that you might think the costs in your project are allowable, and just make sure that they follow the NIH guidelines. You can contact myself or anyone in our office, and we will get back to you within a day turnaround. So we start with, it will be the salaries and benefits, your personnel costs. You'll list each of the name and position of each of the person that you're going to be budgeting for in the project. Even if you're not going to be providing, not requesting salary, and you have someone that's key that's providing the service, we would like to know what their effort is going to be. In the justification, we have the titles of consultant costs. If you are going to have a consultant in your application, please include their name and the proposed amount that you anticipate giving them, and why they're the best person for that to be the consultant. Equipment, we highly recommend that nobody requests for capital equipment. If you're going to request for capital equipment, please contact the Grants Office right away, because we need to know about those things to make allowances for the application. Supplies, that can be materials, it can be laboratory costs, it can be computers if it's specific to the project. But if you have any questions on that, please let us know. Travel costs, I anticipate travel costs being fairly high, since your projects are, many of them are going to be traveling out to Native American communities. You're going to see higher travel costs. Make sure that you stay within your institution or federal guidelines. Inpatient, outpatient costs, those are pretty self-explanatory. If you have any questions on those, please contact our office. Alteration and renovations, that's really not applicable to this pilot grant process. Other expenses, they can include food, if you're going to be having together with, what do I want to say? If you're going to have meetings with the community leaders, those types of things. It can include patient stipends, incentives. Let's see what else. Focus groups, possibly a room charge for some of the community costs, those types of things. If you have any questions on that, please call us and we can go over that with you. And then there's the direct consortium contractual costs. This section should include the direct and indirect costs of any consortium or contractual arrangement. And their detailed budget, if you have a consortium, needs to be just as detailed as what we're requesting from you from A through I also. Facilities and administrative, F&A, indirect costs. The signing official and the grant or the grant office of your institution should have your indirect negotiated agreement. If you don't have one of those, or you don't know who in your facility to contact, start with someone in the finance office. They should have all this information, and you need to complete section. I think it's section L on the facilities and administrative part. You need to put in when your agreement date is and what your F&A rate is and calculate it, and you need to check the appropriate box if you're basing your F&A on salary and wages, modified total direct base, or other. And we get to the appendix. Appendix A, again, all the biographical sketches for the PI and all key personnel will be entered in this section. Appendix B will be the consortium and contractual arrangement and all letters of support and the mandatory tribal or partner letters. Appendix C will be the publication. You can include publications, surveys, questionnaires, other data collection, instrument information, clinical protocols, informed consents. This will also, I'm trying to think what else was on there. I think that's basically what all goes in that section. Your IRB letters can also go in that section. And again, the applicant submission deadline is February 24th at 5 p.m. Central Standard Time, and your application needs to be emailed to our Research Grants Office email, and each of the applicants will receive a confirmation email from our office that it was received. And if you have any questions, and please contact the CRCAIH office, and the information is provided. Also, any questions, we provided that is my phone number, and you can send any questions to our grants research office, and we will get back to you as soon as we can. And we look forward to receiving your application, and please do not hesitate to call us for any assistance that you need. Thank you.
Great. So just thank you, Rhonda. That is very informative and helpful to walk through the application and those detailed steps. So we just want to, of course, always acknowledge all of the people that go into CRCAIH. The Pilot Grants program is just one small part of all that CRCAIH does. So we want to, of course, thank everyone that goes into making CRCAIH a success. And then currently, we're going to open the line for questions and have a question and answer time. So please, when you're not asking a question, please mute your line. So if you could mute your lines now. We are unmuting the phone as I speak. So please also feel free to type in any questions as they come to you. So as I said, this is your time for, we know that the folks, you guys are on the line. You guys are really serious about applying for the Pilot Grant program. So now, please, if you have any questions, that this would help the broader group as well. So please take this time to ask the questions and type in anything that you have. We did get a couple of questions ahead of time, which was great. So Rhonda, I know that you had a couple of, we have phone and email to contact you. What is the best way to reach you? And before you answer that, if everyone can mute your line, that would be great. Thank you.
The best way to contact me would be probably by email. You can also phone me, though, at the 605-312-6077. And you can email me at researchgrants@sanfordhealth.org. That's also on the webinar.
Great. And then another question we got, I think you mentioned this, if someone is submitting an application with revisions on that first page of the applications, should it be submitted as a revised application or a new application?
It should be checked as revised and then put the date that you submitted your previous application.
Great, thank you. So any application that with the same topic that you may have submitted last year, please submit that as revised. And as stated in the RFA, you get one chance at revision, much like NIH. So we developed this RFA and application process. We modeled it a lot after NIH guidelines, just to build up people's...
I don't know what it is. I'm in Indiana.
Hi.
I don't.
If you can mute your lines, that would be great. The lines are open right now for comments. So all of the information that Rhonda detailed is going into the NIH, going to NIH for review, and that's why we ask all of those detailed questions.
Colorectal.
So great.
A cancer survivor.
Okay, so I have a couple of questions typed in the box. One question is, do indirect costs get taken out of the $240K? And that's actually a good response, I think, is that the answer is no. The indirect costs are taken on top of the $240,000 that we've dedicated. So because every institution's indirect rate is different, we did not budget that in, but we have plenty of money to take that into consideration, and we'll look at all of the awarded applications will be awarded their indirect costs at whatever level their institution is at. Great. And we have another question about the review process. So many of you are probably interested in, okay, those are the scary reviewers. That's like the hardest part is thinking about those reviewers. And
I think we may have to mute the lines again if we keep on getting feedback.
Okay, great. So what's great about the CRCA is our review process is external. So because CRCA has division and core resources that can be dedicated to helping you put together your proposal, we can help as much as we possibly can without confounding or seeming like we're playing favorites, because we have an external review process with folks from across the nation who are outside our North Dakota, South Dakota, and Minnesota area. So last year we had a team of 8 reviewers that at least half of them were in American Indian Health Research and American Indian themselves, and all of them are minority health researchers. So they really bring that high level of expertise in reviewing these grants. So the review process that we're doing this year is each of your projects will be scored on those 5 categories that I detailed in the webinar last time that the reviewers will be looking at. So each application will be given assigned to 3 reviewers, and you will receive written feedback from each of them and scored on with a total of 100 points in terms of how they're meeting those criteria. So with that review process then, as the individual reviewers will go through your application and score them on those categories, then we will come together in a teleconference call, and the top applications will be discussed. I just want to look at that. All right. So the next question is, will qualitative research be funded? So I'll take that one. Our both qualitative and qualitative proposals will be accepted, and neither one are favored. We don't have anything on design favoring one versus another. And many of the projects last time had both a qualitative and a quantitative focus. It just depends. What we're really scoring on is that research question, how rigorous that is, how your design fits the research question. So definitely qualitative research, interviews, focus groups, ethnography, content analysis. We are happy to receive those proposals. So as long, I think, designing your project that best fits your research question, we are very open to that. So be happy to talk with you about how to best design that. So a next question. A lot of urban Indian programs do not have an indirect cost, and a lot of organizations may not have an indirect cost negotiated with the federal organization. What national percentage do we use that would be considered valid?
That's a hard question to answer. We probably, I guess I would want you to contact me, because I'm going to have to contact NIH directly to see what they will consider as acceptable. I mean, different agencies will sometimes allow you a different rate. So if I could have a little bit more information about your institution and what you're applying for and what you're using your calculations for, then I can get back to you on that. So just contact me.
Mm-hmm. And that's something we looked at last year's program in trying to help the organizations apply for that indirect rate, and that's kind of a long process that
Yes.
we can help out with. So I agree that would be a good question to follow up with. Great. So next question, does each project need one person in the categories that we mentioned on the PowerPoint? So when we're talking about transdisciplinary teams, these were just categories that we're suggesting. So tribal health administrators, spiritual leaders, academic health researchers, or healthcare providers. So again, those were kind of categories of different types of people that may include and be a part of your transdisciplinary team. So, but no, you don't, it's not mandatory to include one of each of those people in your team. I think in talking with different applicants, the best way that you put your transdisciplinary team forward, whatever makes sense for your research question, and how you put together the strongest team, I think that's up to you. So you wouldn't necessarily need someone from each of those different types of categories, but however you feel like you're creating a strong team would be good. So hopefully that answers that question. Good. So next question, we mentioned that the grants office can help with the budget. How does that usually work? And when do you recommend starting on the budget?
As soon as I have identified the project that you are going to work on, I would contact the grants office, and what we would do is we would ask you all kinds of questions and get some detailed information from you about your project and personnel, and we would put the budget together for you, and we would work with your institutional finance person to review and approve your budget for the application. So if you have a grants office or a departmental person that you want us to work directly with, or you want to work directly, the PI wants to work directly with us, just give us a call and we will start working with you on your project.
Yeah, I would say, like, the sooner that you can reach out to the grants office to talk about budget, the better. I know I was just talking with someone this morning and said, they're going to ask you this question and how many subjects and how much you want to pay for incentive. And even if you don't have those questions right now, working with Rhonda, she'll throw out a lot of questions to make you think about those things and what percentage of the effort may you need on different personnel. And working with budget is really important when you're trying to scale your research question to a project that will can be attained in 1 year. So it is really an iterative process working with Rhonda that will help. And I guess for myself, I would say the sooner the better to contact her and start working on budget, especially if you don't have someone at your organization you can talk to about those questions. Great. So next question, would letters of support from tribal partners be needed if subjects are urban American Indians? So the answer to that question is no. So then we may have misstated that a little bit, a little misleading. So what is required for this application is letters of commitment from your partners. So although so whoever the partners are on the grant, whether it's a research institution, a university, a community organization, a tribal organization, whoever those big partners are with the grant, those are the letters of support and commitment that you'll need. And as I detailed in the last webinar, a lot of times those letters of commitment are very time consuming to obtain, and a lot of your partners are going to be busy. So the sooner the better you can reach out and get all of your partners on board, the better. So if that makes sense, that all of the big organizations that are committed to your project, especially if they're committed that you're obtaining participants through those organizations, if anyone is doing any data collection or you're obtaining records from them or obtaining any input on your project, you're going to want a letter of commitment from that organization. So the next question, if you can flip to this, is can you review the PI, co-PI, and co-investigator roles and where their information should be included in the application?
Well, you're first going to probably put that in the multiple principal investigator leadership plan. If you're going to have a co-PI, you're going to describe what the principal investigator versus the co-PI will be doing and their roles that they'll be playing in the project and who's going to be in charge of what at maybe which site if you're going to have multiple institutions. You're also going to want to include that in your proposal to show how as you describe your project and what the personnel and the co-PI and co-Is might be dividing duties and their roles within the project. You will identify it, so you'll do it in your research plan. You're also going to describe that in the budget justification. You're going to tell us what you're going to describe the role of the PI, what the role of the co-PI is going to be, and the co-investigator in the budget justification. Any other place that you would anticipate seeing it?
I think that covers it.
I think that's the 3 places that you would put that information.
Mm-hmm. And just to reflect on last year, we only had, you don't have to have all 3 of these roles in your application. Last year we only had 1 co-PI situation. The rest of the applications that were funded just had a principal investigator and then other investigators underneath or other personnel that were working with them. So you're not obligated to have all 3 of these roles. Good. So next question, as we were on letters a little bit ago, can we define the difference between collaboration versus support letters? So typically we think of support letters as those individuals or programs who know our program history, mission, work, and the proposed grant and support the application. So a lot of times it's very good to have letters of support, letters of commitment. Like the more letters, the better, to show that the support for your application and moving forward, that this is going to be a successful program. So where we may use these terms interchangeably, I think that Tabitha kind of got me going on letters of commitment kind of is stronger than support. So what we talk about in what we want from our letters and what I think is most important for the reviewers to see is that the partners that are involved, that they are committed, that these conversations have happened, and that everybody's on board with the proposed design and project, so that each of the partners that you've outlined in the grant, that they are all committed to doing what they said they would do in the grant. So that someone couldn't just write in, oh yeah, I'm going to work with Oglala Sioux Tribe, but that having a letter from a tribal organization or a tribal health director, that actually shows those conversations have happened, and yes, they agree that this is an important project, and are committing, this personnel or this organization or this space. The more detail in your letters, the better. So I think that both letters of support and commitment are important, especially for those partners that are committed to the project being successful moving forward. Anything else you want to add?
No, I agree.
Okay. Good. Okay, so the next question on budget. Do you have any idea what the average size of the grants will be? What is the minimum and maximum that will be allowed to be requested? So for direct costs, this year we are asking for projects that range from $25,000 to $80,000 for that 1 year project. And last year, we had most of the projects that we received were at that upper limit of funding requests. So, of course, everybody wants like the biggest project they can write for, which we totally get, and we do the same thing when I apply for grants too. What I've been doing this year, I think everybody's kind of been doing, is to encourage people to write for the amount that you actually need for the project to be successful. So, of course, we want to fund as many projects as we can. What we do is take those top, in the review process that I described a few minutes ago, is we look at those top scored projects. And that's where the funding decisions will be made after that review process. What are those top ranked projects? And if those are the highest funded projects, those will probably be the projects funded. Now, at a certain point in looking at the budget that we have to work with, we maybe then, I could see looking at, okay, we've committed to funding these two bigger projects. Are there any smaller type projects that we could fund as well? So hopefully that gives you an idea of how that decision may be made. I've definitely been encouraging people to apply for a lower amount if they're able to do that project with that funding. Yes, so the question is just a follow-up on an earlier one. Again, Rhonda and I are doing this webinar, so you can reach her at researchgrants@sanfordhealth.org, or just emailing. We're a very close team, so just emailing info@CRCAIH.org will get you to the right person. So even if you've missed some of the contact information in this webinar, feel free just to email that one, and we'll get you to the right people, the Sanford Research Grants Office, to Rhonda, to myself, to all the cores and divisions. We will help answer your question. Next question on back to the co-investigator. Are research assistants considered co-investigators?
Well, many institutions have a different title for what makes up a research assistant. I consider a co-investigator someone that is assisting the PI in the project in a major way. A research assistant or a research associate in our institution is considered someone that's doing the field work, the day-to-day data collection. They're not key to the project, but they are providing and collecting data for the PI. So it depends on what your institution is identifying that research assistant as. Some people do include postdocs as key personnel, maybe staff scientists, but in our institution, usually that is not a key personnel person unless we can justify why. If they bring a special technique, expertise to the program or the project, then we consider them key personnel. I hope that answers your question. If not, contact me. We can discuss it some more.
Mm-hmm. And a lot of those decisions will be made on a project by project basis, so it's always good to bounce that off of Rhonda as you're trying to decide. And one thing I'll mention on key personnel that our director, Amy Elliott, always tries to get into our head as we're writing grants is not to put too many key personnel into your project, because if you need to change those people, if for some reason they move or different things don't work out, then what that stipulation means is that you have to contact NIH and get approval to remove them from a project. So we are very sparse with our who we designate as key personnel, and especially for these one-year grants. Which brings me to my next question. What if my project will take longer than a year to complete? So what we have right now is a situation that so we're dedicating a year of funding that we hope, you're able to spend out all of those funds in a year. However, we know a lot of times with grants, they take a little bit to get your personnel going, or this happens, or another thing happens. And what we have in the RFA and application outlined is that you will be allowed to apply for carryover. However, it will not be guaranteed. So we encourage you to spend those funds in 1 year, but we'll have the chance to apply for carryover. Of course, that always depends on what our federal funding levels look like. Question, when will our seminar slides be available online for download or printing? And I'm happy to tell you that the slides themselves will be available on CRCA.org this afternoon. It will take a little longer to get the audio along with that. Question, would projects with direct costs less than $25,000 be considered? Rhonda and I are both looking at each other. It is in our stipulation. I don't think it would hurt if there was a research project that you could do within a year. We're definitely not leaning on the upper end of that, but I would say please contact us and we could discuss that further. My concern would be, is there enough there for a full-fledged research project? But I say let's talk about that offline. Wonderful. In the next few minutes, in our last minutes, are there any other questions? We're going to unmute the line again. Thank you so much for using the text box comments. Great. Again, just letting you know that the phones have been unmuted for the last couple minutes of our webinar. If there's any other burning questions. We're getting positive feedback, which I always love to see. We really hope that you found this webinar helpful. Good. And we really look forward to working with you as you complete your applications. Again, we see this as really an investment in new investigators and organizations that have a research question that want to collect some pilot data to move our knowledge forward and what we know about American Indian health, and just increase that research on social determinants of health in American Indian health in our region. So we really thank you for your interest and your time today and look forward to hearing from you.